Have you ever wondered how it feels to live in a world that blurs the line between reality and imagination? Welcome to the world of schizophrenia, a realm that seems as mysterious as it is misunderstood. Schizophrenia is a severe mental disorder, often characterized by abnormalities in perceptions or expressions of reality. It can impact how a person thinks, feels, and behaves, making it incredibly challenging not just for those who have it, but for their loved ones as well. Imagine a world where your mind plays tricks on you, where the lines between the real and the unreal are blurred and distorted. This is the world that people with schizophrenia navigate every day. It's not a figment of imagination or a sign of weakness. It's a real, complex, and often misunderstood disorder that affects millions worldwide. Schizophrenia, indeed, is a complex and often misunderstood disorder. Now, how can we identify if someone might be living with schizophrenia? Let's explore the signs and symptoms. Schizophrenia manifests in a variety of ways, but there are common symptoms to look out for. The first group includes positive symptoms. These are behaviors or experiences that are added to the person's life due to the disorder. Hallucinations, for instance, are common. These are sensory experiences that seem real, but they're created entirely by the mind. They can affect any of the senses, but hearing voices is the most common type of hallucination in schizophrenia. Another positive symptom is delusions. These are false beliefs that the person holds, even when confronted with evidence to the contrary. For example, they may believe they're being watched or that they have special powers or abilities. The second group of symptoms are disorganized symptoms. This includes disorganized speech, where a person might jump from topic to topic without clear connections or give answers unrelated to the questions asked. Disorganized behavior might show as problems with routines, hygiene, or inappropriate or unpredictable behavior. Lastly, we have negative symptoms. These are aspects that are taken away from the person due to the disorder. They might include lack of motivation, emotional flatness, or withdrawal from social interactions. Recognizing these symptoms is the first step towards seeking help and getting a proper diagnosis. Each symptom alone doesn't mean someone has schizophrenia. However, if someone you know is experiencing several of these symptoms, it might be time to encourage them to seek professional help. Diagnosis is crucial in managing schizophrenia. But how do medical professionals determine if a person has this disorder? Well, the process involves a series of evaluations and criteria. First, a thorough medical examination is conducted to rule out physical illnesses that might be causing the symptoms. This could include blood tests or imaging studies. Next, a psychiatric evaluation is done. This involves observing the person's appearance and demeanor, asking about thoughts, moods, delusions, hallucinations, substance use, and potentially past mental health issues. The key tool in diagnosing schizophrenia is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, also known as the DSM-5. This manual provides criteria that must be met for a schizophrenia diagnosis, such as experiencing symptoms for at least 6 months, with at least 1 month of active symptoms. Though it may seem daunting, it's important to remember that an accurate diagnosis is the first step towards effective treatment. While there is no cure for schizophrenia, it doesn't mean it's the end. There are treatments available that can help manage its symptoms. Let's delve into some of these treatment options. First up, we have medication. Antipsychotic drugs are typically the first line of treatment for schizophrenia. They help to regulate the brain chemicals that contribute to hallucinations, delusions, and other symptoms. However, like any medication, they may come with side effects, and it's important to discuss these with a healthcare provider. Psychotherapy is another essential component of treatment. Individual therapy can provide a safe space for people with schizophrenia to understand their condition and develop coping strategies. Cognitive behavioral therapy, in particular, has been shown to be effective in managing symptoms and improving quality of life. Social skills training is another form of psychotherapy that can be beneficial. It focuses on improving communication and social interactions, crucial skills for leading a fulfilling life. Lastly, lifestyle changes can also play a significant role in managing schizophrenia. Regular exercise, a balanced diet, and adequate sleep can all contribute to overall well-being. In addition, avoiding drugs and alcohol, which can worsen schizophrenia symptoms, is crucial. Support groups can also be an invaluable resource, providing a sense of community and shared understanding. These groups often provide practical advice, emotional support, and the reassurance that no one is alone in their journey. Remember, with the right treatment and support, Individuals with schizophrenia can lead a fulfilling and meaningful life. In this short span of time, we have explored the world of schizophrenia, its signs, diagnosis, and treatment options. We've journeyed through understanding the condition, recognizing its symptoms, and discovered means of diagnosis and treatment. Remember, mental health is as important as physical health. Let's break the stigma, spread awareness, and create a supportive environment for everyone.